Hello and welcome to the Bub Report. As the Caribbean public health infrastructure races against the clock to get its population vaccinated against the coronavirus, there is an epidemic of misinformation that has gained a significant foothold in the minds of substantial swaths of the Caribbean as well. Consequently, there is now considerable vaccine resistance resulting from the social media consumption of a deluge of conspiracy theories. Consequently, there is now considerable vaccine resistance resulting from social media consumption of a deluge of conspiracy theories, suggesting, for example, that Bill Gates invented the virus and the vaccine to execute an elaborate depopulation campaign against people of African descent worldwide, to notions of a globalist cabal ushering in a sinister new world order, to microchip implants in vaccines, 5G, and so much more. Conspiracy theorizing in the Caribbean even made its way into a Catholic church in a sermon delivered by a Grenadian priest, Father Gerard Paul, in January of 2021.
This vaccine has not been checked out. What they did is that they looked at symptoms and they tell you, oh, it's like SARS-CoV-1. Same symptoms like SARS-CoV-1. 80% of SARS-CoV-1. This psychopath, Bill Gates, is telling us that we need to all be vaccinated with his vaccine. And the whole world is listening to that. And governments are following what Bill Gates is saying. You need to be vaccinated.
I say to people, the last thing I want to say, if you are in this, at this level, and you have concern, I urge you, keep it to yourself as much as possible. It is not fair to those of us who may be having less knowledge of the significance of this. If I hear someone, I have my doubts, and I hear someone who is at a ministerial government level or senior serious person in the community, even a Reverend Mark, if I hear people like Reverend Mark or anybody at that level say, and a nurse or something say, me ain't taking it, this would create further problem.
Conspiracy theorizing around vaccines and public health is not new in the Caribbean, and it is also consistent with prevailing anti-vax attitudes in African diaspora communities globally. Admittedly, one must acknowledge the history of racism in healthcare as one of the reasons for the flurry of conspiracy theorizing now apparent. Anti-vax attitudes, once labeled as a fringe idea, are also becoming mainstream. The irony of the COVID-19 vaccine resistance is that Caribbean citizens are required to take a set of routine vaccine shots to be immunized against diseases such as chickenpox, the annual flu, polio, hepatitis A and B, measles, rabies, typhoid, and yellow fever. In fact, save for some very few exceptions, your child cannot enter public schools in the region unless they are vaccinated. Today on the Bub Report, we discuss all things COVID-19 vaccine related with a team of medical and public health experts. We welcome our guests, Grenadian American physician Dr. Renee Goodson Oliver, wellness expert and medical entrepreneur Dr. Monica Simisola, general practitioner Dr. Ibrahim Walde, Colin Curtin, communications manager of the Caribbean Public Health Agency. We thank you all for joining us for another installment of the Bub Report. A pleasant good morning to everyone, and let me take this opportunity to welcome you to the Bub Report. And on today's episode of our program, we want to be able to address the concerns related to the vaccine distribution in the Caribbean region. But before I begin, I want to take this time to remember a friend and colleague in the late Levi Benoit, who was buried last week in Grenada. Levi served his country as a cameraman and a trade union activist with the Grenada Broadcasting Network and the Technical and Allied Workers Union for the better part of 30 years. I personally had the privilege of working with Mr. Benoit as well, as we shared some very wonderful memories during our time at the network. I therefore want to take this opportunity to extend my deepest condolences to Levi's family and to the media fraternity at GBN on his passing. And now onto a program. As I stated in the intro, we will be taking a look at the current efforts by Caribbean governments to vaccinate its population by way of the COVAX facility, which has as its mandate the equitable distribution of COVID 19 vaccines across the Caribbean. The issue, though, is that significant portions of the Caribbean population are still very resistant to the notion of accepting the COVID 19 vaccine. And so, what we want to do today is to have a discussion around the vaccines, but we want to begin by speaking to the communications piece of this. And we want to bring in Colin Curtin of the Caribbean Public Health Agency and Mr. Kevin Frederick, who is a public relations officer at the Ministry of Health in Grenada. Ladies and gentlemen, welcome to the Bub Report.
Thanks.
Yes. So I want to begin. What is the strategy? I would begin with Colin. What is the strategy for combating misinformation around the conspiracy theorizing that has reached fever pitch really in Caribbean spaces?
Well, Callan, first of all, I just want to make a distinction or a differentiation between misinformation and disinformation. Misinformation is when we unintentionally spread information that is wrong or inaccurate. And it may be something that we saw on the TV or something that we got via social media. We don't necessarily know that it's wrong, but we shared it, and that's misinformation. When we speak about disinformation, though, it's deliberately spreading information that is intended to harm or to mislead. And so the difference between the two, I dare say, has a lot to do with intent. So from my experience in the Caribbean, we are seeing an abundance of misinformation, which is being amplified through the social media, as you so correctly said just now, But do we have a regional communication strategy that addresses vaccine misinformation? Absolutely, we do. As you know, CARFA is leading the COVID-19 public health response in the Caribbean region. And I just want to let you know that in 2015, we established a regional health communication network. And that network, we provide this very robust network with guidance. And that is CARFA through the provision of technical documents, and we facilitate the sharing of communication materials and also risk communication training. To get to your question, where in terms of combating the spread of misinformation, though, similar, I would liken it to what epidemiologists do actually, who would monitor and track diseases through surveillance systems. We too establish surveillance systems as communicators to listen and track misinformation and also disinformation. So that then helps us to understand what the public's concerns are, to understand what their information needs are, and then we proactively share information that is accurate, reliable, and timely that can counter and limit the spread of misinformation. And of course, we do it in formats and through channels that match how the misinformation is spread. So one of our key strategies is to communicate transparently and to take visible action that would build trust in the vaccine. We also know, Calon, and you would agree with me on this, that limiting the spread of misinformation requires a whole of society approach. So that we are engaging with communities, we are engaging with having media stakeholder engagements, we're engaging with non-governmental organizations, academia, community leaders, and others, so that we can successfully promote vaccine uptake and confidence. You must understand that individual and community leadership has to be at the core of our strategy. And That is also critical in building trust and credibility. And then, of course, we learn from those interventions and we apply it to future preparedness and management of infodemics, as we have coined that phrase now.
It's an and I'm going to bring in Mr. Frederick. Mr. Frederick, in Grenada, misinformation is significant as well. I would say if we were to do a snap on scientific poll of vaccine resistance in Grenada, you would find that perhaps a significant portion of the population would not accept the vaccine when offered. How is the ministry dealing with that? And I mean, this is not only this is not an abstract thing. I mean, you have Grenadians who listen to social media experts, shall we call them that, more than they would listen to the Minister of Health or the Chief Medical Officer or the World Health Organization. As a matter of fact, there is also a significant institutional mistrust as well. Mr. Frederick?
Well, thank you, Kellen, for having me. And just to echo most of what Colin would have said, that is the strategy that we have also adopted. Thankfully, CAFA has been leading the charge with all of the RISCOM specialists in the various islands. And I happen to be one of the persons who were trained by CAFA. So, we understand how do we go there and share the information. Now, what we have done in Grenada was to segment our population based on the resistance that you have spoken about, Kellan. And it is all enshrined in our RISCOM strategy for vaccines. Now, building trust, that is our core objective here, which will then create the platform for rollout. And what we did is that to do that, we started with vaccinating our Prime Minister. Then we move on to our Minister for Health. And we also roll out to other persons. For example, the Commissioner of Police, the Father Mark. And I heard you played a piece in the introduction, and that was relating to a different Father Mark. But we have been doing that. And also, because we realized that a lot of the misinformation is primarily spread on social media, we have amped up our social media, if you want to call it sharing. We post almost every day. We post, and we have been locking down quite a number of persons who then would have had some resistance. We are now seeing that they are turning around and they are sharing that information as to the positives, and that's what we have been doing lately. Now, I must agree to that the media is an important stakeholder, and to do so as part of our strategy, part of our training involves the media, because we know that they are the ones who will carry the message. As a matter of fact, Kellen, later this week, we will be engaging media persons, and part of the strategy will also include offering media persons the benefit of having the vaccine. Now, I, as you know, have been in media for several years. I took the vaccine likewise, and I have been speaking about it, about my experience. And I can tell you the only side effect I had was just the little, sting on my shoulder. And after that, it was, just a bit tender for about a day. But it did not curtail my regular activities. And since I have been speaking about that, I have received a number of inbox messages and so on, and just communicating with people as to why they should really take the vaccine. But I do agree with you. There is still a lot to be done, and programs like yours will, of course, help to clear up that misinformation that is circulating in our country at this time.
And Colin, let me bring you in, because I know that CAFA, you've engaged in a training strategy for communication specialists around the region, but CAFA has a much more significant and important role with respect to helping Caribbean governments administer their public health mandates, not only with respect to COVID-19, but with respect to other public health concerns that affect the Caribbean region. And so the other question that I have really has to do with how is your communication strategy I guess, blended with or combined with your other public health initiatives?
Well, Kellon, give me the opportunity though to just address something else at this time. I know that you spoke about in the clip that you played previously about the track record of high vaccination coverage and so on with yellow fever and all of those. And we do have a high track record, vaccination track record in terms of coverage for routine child vaccinations. But as you are aware, it is a bit different for adult immunization programs. And we are seeing this trend of vaccine hesitancy. In fact, WHO identified vaccine hesitancy as one of the 10 global health threats facing the world today. A survey conducted by Johns Hopkins actually reported that in some of our member states, there are rates as high as 62%, indicating that they would not accept a COVID-19 vaccine if it were made available to them. We acknowledge that, and we recognize that as the regional public health institution leading the COVID-19 public health response, we have to identify the barriers to vaccination uptake. And with that in mind, we launched a survey, which comes back to your question that you just asked. We launched a survey to assess the beliefs and opinions of persons living in the Caribbean region about COVID-19 vaccines and also the potential barriers to acceptance. So this survey is going to be an essential tool in the development of a public education campaign and one of our strategies in combating the mis and disinformation about the COVID-19 vaccine. And for your listeners and viewers who live in the Caribbean region, I want to encourage them to go on to CARPHA's Facebook page, CARPHA, the Caribbean Public Health Agency. They should go onto the page and complete the survey because it's really important in terms of vaccine acceptance, because we know that vaccines don't save lives, right? Vaccinations do. So people have to take the vaccine. So that's one of our key strategies as well in terms of utilizing that survey tool to help us in constructing or developing a health promotion campaign, which will assist not only CARPHA as the regional health agency, but also our member states. It's a key and essential tool.
And Mr. Frederick, we actually have a comment here from a viewer. A viewer comment here. Mr. Ernesto says we can't blame people who have their doubts because of misinformation. It is because our government didn't educate our people on the vaccine, but we only tell us that we're getting a vaccine before March and no other information or community forum to educate the public. So people have been doing their own research from the social media and forums and form their own opinions. I believe that is what he was attempting to say. Colin, and how do you respond to that, Colin?
Well, what I would say is that this is not new. Concerns and misinformation about vaccines, that is not new. There has been anti-vaccine advocacy and pamphlets being put out since the 19th and 20th centuries against polio and smallpox vaccines. But what I can tell you is that I know for a fact that we are all here because we have been vaccinated. So we are testimony to the benefits of vaccines. And if we were to look at the vaccine demand continuum, which SAGE Working Group had produced based on their studies, it shows that only a small segment of persons outright refuse vaccines. Most persons demonstrate a passive acceptance. We call that the movable middle. So studies have shown that most persons may go through some hesitancy. We have the benefit of we weren't around during the smallpox and polio epidemics. We weren't around at that time. We are around now. And when the epidemic, and we benefited from the vaccines, and I am sure at that time as well, persons were probably hesitant. But look at the result now.
Except the difference now is that people have multiple sources of information. Some of those sources are unverified sources of information. I'm hosting this program. Certainly, if I were to be having a conspiracy theorist on here, I assure you that the viewership would be much higher than what we're witnessing.
Yes. So, but what you have to realize too, Calon, is that studies have shown that most persons will go through some hesitancy, right? But when the vaccine is made available to them, most persons, as I said, they're in that passive acceptance group. They're in that movable middle group. And once the vaccine is made available to them, and we, along with the accurate information that we are currently sharing, scientific based evidence, they can realize the value of the vaccine. It is proven to them, and then they will be moved to accept the vaccine. And of course, we know that each country has its own socio-political, economic, and cultural circumstances that may lead to different factors affecting the vaccination uptake and coverage. But what is important, we know our strategy is to build trust through taking visible action, sharing clear, complete, accurate, timely information, and empowering our healthcare workers as well, and individuals and communities, so that they can tell their stories and they can share the accurate information among their communities. And that is our thrust right now, trying to get that movable middle to accept the vaccine. And I dare say, if you look at it right now, you are seeing people clamoring. They are coming in droves to get the vaccine. I'm sure you have that experience in the US as well, where persons were very hesitant, and all of a sudden, you don't have enough vaccines, you don't have enough room, right? So that most of us are in that passive acceptance group, and we can be moved. Our role as communicators is to give them the information so that we can move them from the left to the right side where they take that vaccine.
Is this the first time that you've had to really think about people's belief systems around vaccines in the Caribbean, and develop a communication strategy for combating a lot of the irresponsible, quite frankly, pieces of information that go viral?
Well, certainly, I don't think it's the first time for me, but certainly I don't think it's the first time in history, because we know that there have been even just the H1N1, which we had to do a similar thing recently, where we have to try to convince persons to have confidence in the H1N1 vaccine. But this is a bit different because it is a pandemic. People are dying. We have had more deaths in the history of any kind of pandemic or flu like this. We've never seen this. And as you said, social media, the advent of social media and that communication channel really presents a challenge. So I think that is where the major differences in terms of the method or the means of communication, where we have social media entering the front now, and that is in fact a challenge. So we will continue to track our misinformation, continue to track and monitor the information via especially social media, and combat that with accurate science-based evidence, build trust. And we know that studies have shown that persons have a lot of confidence in public health agencies, in public health institutions, in scientists, and in the healthcare personnel. So we have to use these persons, take visible actions, show them these persons taking the vaccines, help them to build confidence, and roll it out. And I think so far we are winning the fight, and we will do so.
Fine, but there is another question here that says, as part of the COVAX facility, manufacturers requested of participating member states that they enact indemnity and liability legislation to access the vaccines. I'm not aware that the government of Grenada, I think this commenter is speaking to Grenada, made this clause public to the people they represent. Why? I don't know if you can answer that, Colin, but if you can't, that's okay. I don't know what is the remit that CARFA has with respect to the COVAX facility. What is that remit?
Well, what I can tell you is the COVAX facility was launched last year, April, I believe, by WHO. World Health Organization, and other partners in response to the pandemic. It is the only global initiative that is currently working with governments and manufacturers to ensure COVID-19 vaccines are available worldwide to not only to high income countries, but middle and low income countries as well. CARFA now, with funding from the EU, we entered into an agreement with PAHO, the Pan American Health Organization, so that member states could benefit from the COVAX facility by getting the down payment to Gavi, which is the Vaccine Alliance. And that down payment is approximately 15% of the value of vaccines that countries will procure. PAHO then receives the funds from CARFA, and they will transfer those funds to Gavi for the required down payment. When the vaccines are available, as they are now, member states will purchase them through the PAHO revolving fund. So what I can and want to say is that the COVAX facility is the best opportunity for Caribbean CARFA member states to have access to the vaccine, so that we have fair and equitable access to COVID-19 vaccine, so that all of our people, all of our communities within our 26 member states can in fact get the vaccine, as with other more developed countries. So the COVAX facility is quite a good facility, and many of our member states have already taken up this offer and are using it through CARFA, PAHO, WHO, Gavi, and the European Union, who's providing the funding for it.
All right, Colin, thank you so much for the time that you've taken to join us. We lost Mr. Frederick there, but we also want to thank Mr. Frederick out there at the Ministry of Health in Grenada. Listeners and viewers, please stand by. We will take a break and we will be right back.
Thank you so much, Calon.
Bye-bye.
The vaccines. I've seen all kinds of articles being shared, and when you check the articles either have been overtaken by other comprehensive data, and don't let's get tied up in a domestic geopolitical war between Britain and the European Union, between Pfizer, a German company, and AstraZeneca, a British company. Britain has vaccinated 15 million people with AstraZeneca. Jeffrey, how many dead? Anton, how many dead? We gotta stop this nonsense. And we have people in Barbados who need the guidance of their family, who need the guidance of their church, who need the guidance of their MPs, who need the guidance of all of us, of the media, everybody, in order to guide them, and of course their doctors, because their individual circumstances has to be assessed as well. But if we do that, and we do it well, we can bring down the susceptible population.
And welcome back, folks. That was the Prime Minister of Barbados, Mia Mottley, responding to some of the conspiracy theorizing that is now in vogue in the Caribbean region. But I want to take this opportunity to welcome my guests. I'm happy to be joined by Dr. Simisola Alabi, as she said, I can call her Dr. Simi. Dr.
Yes.
Renee Goodson Oliver, who is a Grenadian American physician, as well as Dr. Ibrahim Wali, a general practitioner. Both Dr. Alabi and Dr. Wali are joining us from the United Kingdom. So we thank them for taking the time to be with us. And I believe, Dr. Oliver, you're joining us from North Carolina, correct?
Yes.
Okay, so let us begin. And so I want to extend that conversation a bit into really trying to get a sense of the origins or where people of color, African descended people really, have a hesitancy or have a mistrust of the public health systems that are charged with their care, right? And I think we have to start there. So would it be fair to say that that would be the origin of a lot of the hesitancy we're witnessing now with respect to taking the COVID-19 vaccine? Any one of you can jump in.
Well, I would say that there's definitely a past history where stuff like this has happened before, but this is actually different. So it's just like even in America, when they've had problems with the Tuskegee experiment, like in the 1920s, or people being vaccinated or getting medical care or medical treatments that they actually didn't need. So there's probably a history of mistrust from that. However, this is actually a pandemic. It's not just something that's going around to just one group of people. It's in Asia, it's in Europe, it's in the Americas, it's everywhere. So I don't think that this type of mistrust should be at this time, but it's probably from a historic point of view.
Dr. Simisola?
Yes, I think we have to look at the health outcomes for Black people. It's not just about the vaccine. Well, Black people historically have poorer health outcomes than the rest of the population. For instance, in the United Kingdom, we know that Black women are 5 times more likely to die in childbirth than their white counterparts. We know that Black people have poorer outcomes from diabetes and hypertension than the white counterpart. There's been a long history of that inequality in health outcomes between us and the rest of the population. So when you have vaccines come out to say, okay, yes, it's going to cure the disease that came on suddenly, which is a pandemic, like the doctor said, there is going to be some degree of, oh, how come? What's going on there? Are we sure it works? Is it right for us? And I think one of your guests said earlier, vaccine hesitancy has been in existence since the 1800s. However, is the degree of hesitancy is way higher in Black people, and is linked to the historic health inequalities and obviously the experiments gone wrong in the past. So we do need to understand where people of color are coming from as well.
And Dr. Ibrahim, I'm going to bring you here. You obviously you guys see patients all the time, and can you tell us what do those conversations look like when a patient comes to you, and they start asking about whether or not they should take the vaccines? I also believe that it also comes down to a decision between a doctor and a patient as well. That has to be balanced against what the general public health needs are. Dr. Ibrahim, you need to unmute your mic, sir. All right. So while he, Dr. Renee, I'll get to you while he figures that out.
Well, right now, I mean, a lot of people, because I'm actually a hospitalist, so I'm seeing people who are sick and who are dying from COVID for the past 1 year. So it's like in my practice, it's like a lot of people are actually wanting the vaccine. So I really haven't had too many people who are having conspiracy theorists and being like that they don't want to have the vaccine. And even if there are 1 or 2 people who feel that way, that they don't want to do the vaccine, a lot of times they're going ahead and getting the vaccine anyway. The biggest group that I may see that may not want the vaccine is maybe females who are in their childbearing years, because they may be concerned that it may do something, to their ovaries, which that was one of the conspiracies that was going around, that it's going to make people infertile. So it's just like that would be like the main group that I would say that may have a little bit of hesitancy of getting the vaccines. But even with that, because here in America, it's just really has devastated the community. It's like a lot of people are wanting the vaccines, and there's many people who have had family or friends or their boss or everyone knows of someone who has died from COVID. Mm-hmm. So it's not that difficult right now to convince people to no matter what the color, race, nationality, people are ready to get the vaccine.
Dr. Ibrahim, I'll get to you. It looks like we were able to figure out your microphone issue there. Go ahead.
Right. Yeah. Sorry about the microphone issue.
That's all right.
Went off. I think it's really important about the doctor-patient relationship, and that's where it's really key. You have to be you have to understand your patients, and you have to understand where they're coming from. A lot of times, especially from the Black and ethnic minority patients, there's this feeling of injustice and not getting access to the right healthcare, or not being listened to. And all of a sudden things with COVID are changing, that everyone is saying, oh, you need to have this vaccine. And everyone's really been, proactive at pushing the Black and ethnic minority groups to have the vaccine. And that triggers suspicion. And I think generally we've always kind of had that background to be suspicious about things being pushed to us, that there's something wrong. And that tailored with the social media, fake news and misinformation that's going around, it's very easy for people to be quite resistant to having the vaccine.
So, and the other issue that comes up as well, and that has to do with again, folks concerned that people of color are being used as guinea pigs in vaccine experimentation. I'm sure you guys have heard that. So tell us what, because obviously before the rollout of this vaccine, you had vaccine trials. Among several populations. What are the protocols around ensuring that those vaccine trials are safe?
Well, yeah. I think with trials, it's one of those that you have to be able to trust that the right things will be done. It's not just the Black and ethnic minority groups, but whoever wants to enroll in a trial will be advised of all the possible risks. This is a new thing that has not been tested on anyone. And the aim of a trial is to try and find a treatment for a condition or a vaccine that will prevent the transmission of a virus. Now that would involve having, it's really consenting. So you have to let the person know all the information, saying, this is what you expect from the trial. We will inject you with either a part of a virus that's inactivated. It is likely to trigger your immune system to do some, to trigger antibodies, which will then protect you from having a virus in future. And most people who volunteer obviously would have this informed decision. So you're not forced to do it. It's an informed decision. You choose to do it. And when taking the vaccine, then you want to look at how you will help people in future. So the key thing about volunteering is actually being there to be part of a treatment that in the future will be beneficial to so many other people. Having said that, in the UK, it's even from the system where we set up for people to volunteer, white people are more than twice as likely to volunteer for a vaccine than someone from a Black or ethnic minority group. Again, so it doesn't show that it's being targeted at the Black groups or it's being experimented on the Black people. This is a vaccine that's open to everyone. Anyone can volunteer for it. So I think this information needs to go out to people, let them understand how the volunteering has occurred for all the vaccine trials. And obviously there are a lot more white people involved in these trials than Black and ethnic minority people because they are worried or scared about things like the vaccine. So this is a long thing. It's a long run. We have to do it for so many vaccines. And I think for the future, we really have to promote that we, the Black and ethnic minority groups, do get involved in these treatments, and we have to trust the health system. I guess, what else can I say?
I think you said it all, actually. I think that's why we're all sort of quiet, because I did
volunteer for the vaccine, actually.
Did you? Were you part of the trial?
Yeah.
For the AstraZeneca trial. However, I did not get picked for it because somehow they tested they went through everything, tested my blood, and they said I had indeterminate antibodies. Which means I was not suitable to have the vaccine. So, but I still volunteered.
So,
And I've
doctor,
actually taken
yes.
my vaccine also. I've gotten the Moderna vaccine, which is the one from Bill Gates, and I'm fine. I did the first vaccine in January, and I did the second vaccine. And the biggest side effect I had was a little arm pain, and that lasted for maybe about 6 or 7 hours, and that was it.
Mhm. Again, the other challenge that we have here is about that trust. Dr. Wiley said trust, right? How do we? Because there is a deficit of trust. We would acknowledge that, right? Between people of color and the medical establishment. How do you think, as medical practitioners, we can reduce that trust deficit that exists?
I think that work has to be done in the community, to be honest, because I think Wally started to talk about Black people not volunteering for the vaccine trials in the first place. And we don't generally tend to volunteer for many things. The same thing with organ donation, same thing with blood transfusion. So the problem is not just with vaccines, it's across board. As you said, the mistrust is between us and the health establishment. So the work that needs to be done really needs to be done by us, by our communities, and the community voices, by all of us who are on this platform, to encourage us to really engage with healthcare, and also to start to sort of look at development on the continent as well. Without development on the continent, it's really hard for us outside the continent to really start to engage with the system. Obviously, if you're really educated and you really understand what's going on, and health literacy obviously is a big thing. So it doesn't mean you don't have a degree. It just means the way you relate with the health establishment and how you understand what they're trying to offer you. So for me, the answer to that really is that our communities need to work with religious establishments, community leaders, community voices, doctors, nurses, people like yourselves who know how to break down health information to start to do this work. And it's going to take a while, I'm afraid.
You said it's going to take a while. You think it's going to be, you have to keep chipping away at it. Dr. Ibrahim, and I'll get Dr. Renee as well to answer the same question.
I think actually what you're doing right now, it's just like really just getting people out there, there's so much on social media where people are having every single day. You can go on social media or someone sending you something on WhatsApp about why not to get the vaccine. So it's just really trying to combat social media, having as many people out there to say, yes, you need to get the vaccine. Yes, there are people who are getting sick from COVID. The people like myself who actually already did the vaccine and say, I'm still alive. There's, my colleagues who have taken the vaccine who are still alive. So, starting there and just saying, I've taken the vaccine, I'm doing well, and I'm around COVID people all the time, and I have yet to get COVID. So, especially after taking the vaccine, I could feel more comfortable.
We have a viewer question. If it wasn't covered before, can someone explain vaccine efficacy and the difference between the current efficacy rates of the WHO approved vaccines?
Yeah, I mean, they're different. I think we in the UK, probably Dr. Wiley and I are used to the Oxford AstraZeneca and the Pfizer ones, but that's what's in the system. And I'm sure Renee can talk about Moderna.
Yeah.
And for us, so Pfizer is about 94%, and AstraZeneca with both doses comes up to the same level. So they're both they're quite effective. And to put it in perspective, they're way more effective than the flu vaccine. So it's really, to be honest, just being able to get one of them, any one of them is fantastic.
Yeah.
Now we also
Moderna has
Dr. Oliver. Yes.
Yeah, the Moderna has about a 94 to 95% success rate. There is another one that's getting ready to come out February 26th, the Johnson & Johnson one. A lot of people are actually wanting to take that one because it's only one vaccination. You don't have to get the 2 shots where you have to go get one and then get another one 4 weeks later. So the Johnson & Johnson one, that's actually a viral vector vaccine, but that one,
can you expand on what is viral vector? What is it when you say viral vector?
It's just how it's formed. The Moderna and Pfizer one, it's actually what we call like a messenger RNA. It goes into the cell, but it doesn't go into the nucleus. The viral vector one is a little different, whereas actually it's more like the flu vaccine that we're all used to. And that one is said that it's about 74% effective. So, I mean, you're that 74% is a little bit less than the 90%, but that one's still going to be a very good one. That's about the same as the flu vaccine. So,
now, yeah, so I have another question, and I was curious about this. Who determines what vaccine would be distributed? So, for example, I know that we have Pfizer, we have AstraZeneca, but other countries have also developed vaccines. We're talking here Cuba. We're also talking Russia, specifically Cuba and Russia. And to what extent are these vaccines? What is the research on these vaccines? And why is it that general populations also can't have access to them in Western countries?
well, I know here in America, here in the United States, it's just whatever's available. I mean, if something's not FDA approved, it's very hard to get it, or if impossible to get it. The only two that were fast tracked and that are approved right now here is the Pfizer and the Moderna. I actually got the Moderna. My husband got the Pfizer one, and the only one I said that we're going to be able to get is the one from Johnson & Johnson, and that's not going to be until after February 26th. Now, the one from AstraZeneca, for some reason, it's not approved in the United States right now, and once it gets its approval, then that one will be available. And then it's just a matter of your healthcare provider. There's no difference with one person needs to get one type of vaccine from a particular company than the other vaccine from a particular company. It's just really what's available at the time.
Dr. Simi, what is the situation in the UK?
Yeah, the same thing. It's what's available at the time. So I run a vaccine center in my area, and basically we just get notified of what's going to be delivered the following week. And sometimes it's the Oxford vaccine that gets delivered. Sometimes it's the Pfizer. The way we decide who to give what is basically based on the stability of the vaccines. The Pfizer is not as stable, and we can't really move it around. So we use it for people who are ambulant, who are able to walk and come to the center. While the Oxford vaccine, we use it for our housebounds and patients in residential care. We've decided that, and that's what the government supports, just because of the very nature of the vaccines themselves. But whichever one you're offered, I always say just take it. Really, there's really no sort of choosing or asking to have one or the other.
All right, that's some very helpful information. So what we want to do, we want to take a break, and we will be right back.
To indulge on this one, I want you to come on a crazy rabbit hole journey with me. It would have to be stable in liquid form. It would have to be super, super small, probably thousands of times smaller than the smallest microchip we have, and also some sort of transmission ability to be able to send it off to the lizard people. Yes, the lizard people. I'll come to that a bit later. So then you post this on Facebook using your phone, which also has a microchip. Wouldn't it just be easier if they put it on the phone? I mean, you wake up in the morning and the first thing you do is you pick up your phone and you use it throughout the day, you carry it around with you, you pay for everything you pay nowadays with your phone. It tracks everywhere you go. Kind of sounds like it's a lot simpler if they just used your phone. It's a lot more cost effective as well, I've got to tell you that. And second of all, why would they need to put the microchips in your body? Like, do they need to know your bowel motions? Do they need to know how often you go for a dump? Pun not intended. Me as your doctor, I don't care how often you go for a dump, unless it's too much or too little. If it's in this green zone, then we just don't need to talk about it. Probably exhausted that, haven't you? Myth debunked. It doesn't change your genetics. In fact, if it were to change your genetics, it would need to go into the nucleus of the cell, the central part of the cell that contains your genetic material, your DNA. This works on the ribosomes, a factory-making part of the cell, so it doesn't even go into the nucleus. Therefore, it cannot change your genetics.
All right, welcome back. That was a very interesting tidbit there. We have a doctor, and I see Dr. Ibrahim nodding, but really what it was just about really speaking to, again, those conspiracy theories that are out there. But moving forward, one of the questions that I have before we get to wrap up is the notion of herd immunity. And some folks were asking whether or not, well, I received the vaccine. It's supposed to be activated. Why then do I still have to wear a mask? Why then do I still have to social distance? What say you, Dr. Ibrahim? I'll start with you.
Yeah, okay. So the concept of herd immunity is really when you get to a stage where most of the population are immune to an infectious disease. So usually you achieve that when about somewhere between 60 to probably 90% of the population are immune. So let's give an example. Let's say if you achieve 80% immunity, that means 4 out of 5 people are immune. So if someone with the virus comes to you who's an infection, who's got the infection, and only 1 out of the 5 would be at risk of getting the infection from that person. So that naturally the rate of infection drops, and that's how infections go away. However, until you achieve that level of immunity, and there are only 2 ways to achieve herd immunity. Either you get infected, which is a much higher risk, more risk of complications, hospitalization, deaths, or you have a vaccine which has less effects and still triggers the immunity. So once you can do that and you get to that herd immunity level, then you can reduce the restrictions. You cannot reduce the restrictions before you achieve the herd immunity. Mm-hmm. It's a bit like saying you've got a fire in a house and it's burning, and because half of the fire is down, it means that you can go back into the house. Mm-hmm. No, so you have to wait until you achieve full control. So that's why at the moment the restrictions are not going down. So even though you've had the vaccine, you've had the second vaccine, you feel you're immune, but there's still so many others that haven't had the vaccine and are not immune. And for that reason, you need to protect those people, and you have to follow those rules until it's such a stage where we achieve that level of herd immunity.
Mm-hmm. Dr. Simisola?
I think it's exactly the same thing. I think there was a big scandal earlier when the Prime Minister said, oh, yes, we might be herd immunity that we're going to have to go for. It has to be herd immunity through the vaccines rather than everybody getting it and a lot of people dying, which is what we're trying to work against. It has been traumatic this last year, as we know, and even one person dying is hard enough. But to see in the UK, way over 100,000 people have died, and it's worse where you are. So really, the race to get the vaccine has been, a global effort that's just had to be done. And we're going to achieve herd immunity via the vaccines, which is a much safer way to do it.
Mm-hmm. All right. Final thoughts as we close the program. What do you hope to see in a year from now? Would we be in a place where we're all going out to have brunch again without wearing the mask, or I would say uninhibited from social distancing protocols and things like that?
Yes, definitely. I'll just start quickly. I'm definitely looking forward to being able to travel without any restrictions, the things you take for granted. But that being said, I'd like to say to everyone who's watching your program that, if you haven't had the vaccine and you're lucky enough to get called in, please go and take it. It's not, it's luck. In some countries, you're having to pay lots of money to get this done privately. And if you're in a country where you're getting it for free, I think you should just go ahead and take it, not forcing you. Do your research, do your homework, but just consider yourself one of the very privileged few.
Mm-hmm. Dr. Ibrahim?
Yeah, I would agree. I really hope in a year's time that if as many people get vaccinated, we achieve a level of immunity, we can get back to normal. We can start traveling again. For the Caribbean, I'm sure everyone misses Carnival.
I do.
I think it would be really nice to get back to going to Carnival again, and we can all socialize and get back to normal. However, to do that, we really need to do a lot now and do the research, read up about it. If you get any information, don't just accept it. Try and, I always try to find the facts. What are the facts about this? Is this person telling fake news? Or is it real news? And if you're not sure, ask a specialist or a doctor to try and explain some of these things to you. And if we can get to that level, then I think life will be back to normal. I see the future, because of all the variants with the coronavirus, that there may be a need to have booster vaccines maybe once a year in the near future, maybe just for the at-risk people. But that's still something we're learning about. And so the storm is not over yet.
And we haven't even gotten to a conversation about the long-term impact of COVID-19 on persons who have been infected with the virus, right? We were talking about these inflammatory syndromes, and we're talking about all of these other mystery illnesses, shall we say. And that also requires another conversation, and of course a lot of research. But Dr. Oliver Goodson Oliver, you from Grenada? You originally from Grenada? Where in Grenada are you from?
Well, actually, I married a Grenadian.
Oh, you married a Grenadian. Okay,
Yeah.
so you are.
My heritage is actually Jamaican, but born in the States and married to a Grenadian. So,
okay.
So yes.
So that's where the Oliver. Well, you are Grenadian, yes. Regardless.
Yes, that's where the Oliver comes from.
Any final thoughts from you?
Yes, definitely in a year. I would like to be at Carnival, and I'm just hoping that everyone gets vaccinated. But I like to piggyback on what Dr. Wall said about the variants. You definitely want to get vaccinated, because we really don't know what the future holds as far as different strains coming out of the coronavirus. This, unfortunately, I don't want to be a pessimist, but this isn't, unfortunately, the end. So it's just like, they're already talking about a Corona 21. So if you get vaccinated now, that can definitely help you with anything that's going to be coming out in the future, and we will be able to get back to normal. Because even though we do see different strains of the flu, the H1N1 or the other flus that do come out, we're able to have a normal life, because it's like a lot of people are vaccinated against the flu. So we'll see the same thing with coronavirus, just becoming one of the viruses that are, that's around and that we're living with. So that's something that we definitely have to think about as we get back to normal, and, have, as it becomes more open and we don't have to wear masks, and that we're able to start traveling again.
Ladies and gentlemen, thank you. This has been a very educational program. Certainly, I know that as physicians, you are busy. I know that Dr. Oliver, you're already at work at your office. Yeah. So I really thank you for your indulgence. We will be having a follow-up program to this at some point, and I think it is a conversation that needs to continue. And I certainly thank all of you for creating the indulgence today and giving us the opportunity to learn from your expertise. So thank you all.
Thank you so much.
Thanks for having us.
Yes. All right, folks, on a programming note, next week we will be, our stream will be dedicated to Black History Month, and we will be celebrating the accomplishments and the legacy of Caribbean Americans in the broad tapestry of African American and Black history in the United States and Canada. So that will be next week. We'll be having a special feature with some very accomplished Grenadians and very accomplished Caribbean people who are doing great things in the American community. So I want to take this opportunity again to thank all of you for joining us for another edition of the Bub Report. You guys have a great week. Bye-bye.